There is a common belief that protecting your kidneys is mainly about drinking more water and eating less salt. Those two habits certainly matter, but they are not the entire picture. One of the most overlooked parts of kidney health is what you eat during the last few hours of the day. For many older adults, the evening is when healthy eating habits begin to slip. Dinner is finished, the house becomes quiet, and before long, a bag of chips, a few cookies, a bowl of ice cream, or a plate of salty crackers appears. It may not seem like a serious problem at the time, but when that pattern is repeated night after night, it can contribute to higher sodium intake, unstable blood sugar, unwanted weight gain, elevated blood pressure, and poor sleep. All of these factors can place additional strain on the kidneys. Today, I want to show you how replacing a heavily processed nighttime snack with an appropriate serving of fruit may support your overall kidney health. Notice that I said support. I did not say that fruit can clean, detoxify, regenerate, or repair damaged kidneys while you sleep. No single food can do that. The kidneys are complex organs, and kidney health depends on far more than one ingredient. Blood pressure, blood sugar, medications, hydration, body weight, physical activity, smoking, and existing medical conditions all play important roles. However, small choices made consistently can help protect the kidney function you still have. Choosing a simple piece of fruit instead of a salty or heavily sweetened snack is one of those choices. Before we discuss specific fruits, there is something important that every person over 60 should understand. Kidney disease can develop without causing obvious symptoms. You may not feel pain. Your urine may appear normal. You may continue with your daily routine without realizing that your kidney function is beginning to change. This is especially important for people living with high blood pressure or diabetes, because these are two of the most common causes of chronic kidney disease. Your kidneys contain millions of microscopic filtering structures called nephrons. These filters help remove waste and excess fluid from your blood. They also help regulate blood pressure, balance minerals, support the production of red blood cells, and maintain the internal environment your heart, brain, muscles, and nerves need to function. When the delicate blood vessels inside the kidneys are repeatedly exposed to high blood pressure or elevated blood sugar, damage can gradually develop. That is why protecting your kidneys is not simply about drinking a large amount of water or following the latest food trend. It is about controlling the conditions that slowly damage the kidney's filtering system. A better evening snack may help because it can reduce your intake of sodium, refined carbohydrates, added sugar, and unnecessary calories, but the right fruit is not the same for everyone. People with healthy kidney function usually have more flexibility. Someone with advanced chronic kidney disease, elevated potassium, diabetes, fluid restrictions, or a history of kidney stones may need a more individualized plan. With that in mind, let us begin with one of the most practical evening choices. Blueberries. Blueberries are small, naturally sweet, and easy to portion. They provide fiber and plant compounds called anthocyanins, which give the berries their deep blue and purple color. These compounds are often discussed because they have antioxidant properties, but I do not want you to think of blueberries as medicine. Their real value comes from the role they can play in a balanced eating pattern. A small bowl of blueberries is very different from a bowl of ice cream, sweetened cereal, or cookies. The blueberries provide fiber, nutrients, and natural sweetness without the large amount of sodium, added sugar, or saturated fat found in many processed snacks. For most people, about half a cup is enough. Fresh blueberries are excellent, but frozen blueberries can be just as convenient. Check the package to make sure no sugar or syrup has been added. You can eat them slowly by themselves or combine them with a small amount of plain, unsweetened yogurt. If dairy products are appropriate for your health needs, do not assume that a larger serving will provide greater protection. Eating 2 or 3 cups before bed adds far more sugar and calories than you may realize. The goal is not to eat as much fruit as possible. The goal is to replace a less healthy snack with a sensible portion. Strawberries are another useful option. They contain vitamin C, fiber, and a variety of naturally occurring plant compounds. They are also mostly water and are relatively light when eaten in moderation. About half a cup of sliced strawberries can provide enough sweetness to satisfy an evening craving. The important word is strawberries, not strawberry-flavored food. Strawberry ice cream, strawberry syrup, strawberry pastries, sweetened yogurt, and many bottled strawberry drinks may contain a significant amount of added sugar. A picture of fruit on the package does not automatically make a product healthy. Whenever possible, choose the whole fruit and keep the preparation simple. Apples are another dependable choice, especially for someone who wants a snack that is easy to find and easy to store. Apples provide fiber, including a form of soluble fiber called pectin. Fiber helps support digestive health and can help you feel satisfied after eating. A small apple is usually a better choice than apple juice because the whole fruit still contains its fiber. Juice is easy to drink quickly. It also takes several apples to produce one glass, which means you can consume a large amount of natural sugar without feeling full. When you eat the whole apple, you chew more slowly, keep the fiber, and are more likely to stop after a reasonable serving. Wash the apple thoroughly and leave the skin on unless you have been advised otherwise. For some older adults, a whole apple may feel too large in the evening. Half an apple is perfectly acceptable. Slice it into small pieces and eat it slowly. You can add a little cinnamon for flavor, but avoid turning it into a dessert covered with caramel, honey, or large amounts of sweetened nut butter. People who experience acid reflux should avoid eating immediately before lying down. In that situation, have the apple earlier in the evening and give your body time to digest it. Red and purple grapes can also be included, but portion control is especially important. Grapes contain beneficial plant compounds in their skins, but they are also naturally sweet and very easy to overeat. Many people sit down with an entire bowl and continue eating without noticing how many they have consumed. Instead, place 10 to 15 grapes on a small plate and put the rest away. Freezing them can make them feel more like a dessert and may help you eat them more slowly. If you have diabetes or prediabetes, remember that natural sugar still affects blood glucose. Whole fruit is generally a better option than candy or cake, but the amount still matters. Healthy food does not mean unlimited food. Pineapple may also be an appropriate choice for some people. It provides vitamin C and a naturally sweet flavor, so you do not need a large serving. About half a cup of fresh or frozen pineapple is usually enough. When using canned pineapple, choose fruit packed in water or its own juice rather than heavy syrup. Drain the liquid before eating. You may have heard that pineapple contains an enzyme called bromelain. That is true, but a normal serving of pineapple should not be described as a treatment for kidney inflammation. Eating pineapple does not directly repair damaged kidney tissue. Its practical value is much simpler. In an appropriate portion, it can replace a heavily processed dessert and help you enjoy something sweet without a large amount of added sugar or sodium. Cranberries are often discussed in connection with urinary health. Certain substances in cranberries may make it more difficult for some bacteria to attach to the urinary tract. However, this does not mean cranberry juice can cure an active urinary tract infection. That distinction is extremely important. If you have burning when you urinate, fever, chills, pelvic discomfort, pain in your side or back, blood in your urine, sudden confusion, or a major change in your urinary habits, do not try to treat the problem with juice. Older adults can become seriously ill from urinary infections, sometimes without developing the classic symptoms younger people experience. Seek medical advice promptly. Another concern is the type of cranberry product being used. Many cranberry beverages contain a large amount of added sugar. Some contain very little actual cranberry juice. If cranberry is appropriate for you, look for an unsweetened product and keep the serving modest. Drinking several glasses will not provide greater protection and may add unnecessary sugar and fluid. Regular cranberry use may also be unsuitable for some people taking certain medications, so discuss it with your doctor or pharmacist when necessary. Tart cherries are another fruit that receives a great deal of attention. They are often promoted for sleep, joint discomfort, gout, and uric acid. Some research suggests that cherries may have a role in a broader gout management plan, but they should never replace prescribed medication or professional treatment. Cherry juice can contain a concentrated amount of carbohydrate, even when no sugar has been added. Dried cherries are even more concentrated because much of the water has been removed. A small portion of fresh or frozen cherries is usually easier to control than a large glass of juice. If you have diabetes, gout, kidney stones, or chronic kidney disease, make decisions based on your complete medical condition rather than relying on a single food. Now we need to discuss citrus fruit, because this is where general advice can become misleading. Lemons, limes, oranges, and other citrus fruits contain citrate. Citrate may help reduce the formation of certain types of kidney stones by making it more difficult for some minerals to bind together. However, not all kidney stones are the same. A recommendation that is helpful for one person may not be appropriate for another. Oranges and orange juice can also provide a significant amount of potassium. For someone with normal kidney function, potassium from whole foods is not usually a problem and may be beneficial as part of a healthy diet. But when kidney function becomes severely reduced, the kidneys may have difficulty removing excess potassium from the blood. Certain blood pressure and heart medications can raise potassium as well. If potassium rises too high, it can interfere with the normal rhythm of the heart. This is why people with chronic kidney disease should not automatically follow general advice telling them to eat more oranges, bananas, avocados, or other potassium-rich foods. Some people with kidney disease do not need to limit potassium. Others require careful restriction. The correct decision depends on blood tests, medications, the stage of kidney disease, urine production, and whether the person receives dialysis. If your doctor has told you that your potassium is high, do not begin drinking orange juice every evening simply because citrus is associated with kidney stone prevention. For people with normal potassium and normal kidney function, a few orange segments can be a reasonable snack. Whole fruit is generally preferable to juice because it provides fiber and is easier to portion. Pears, peaches, and plums are also worth considering. These fruits do not receive as much attention as berries, but they can be simple and satisfying alternatives to processed desserts. A small pear, peach, or plum provides fiber and natural sweetness. Depending on your kidney function, blood sugar, and potassium level, one of these fruits may fit comfortably into your evening routine. The important lesson is that you do not need a rare or expensive superfood. Kidney-conscious eating is often built around ordinary foods in sensible portions. You should also remember that not everyone needs to eat before bed if you are not hungry. There is no medical reason to force yourself to have a nighttime snack simply because you heard that a certain fruit is good for the kidneys. For some people, late-night eating can worsen acid reflux, raise morning blood sugar, interfere with weight control, or disturb sleep. Drinking a large smoothie before bed can also increase nighttime urination. This deserves special attention after the age of 60. Repeatedly getting out of bed during the night can increase the risk of falls, particularly for people with poor balance, weak legs, impaired vision, arthritis, or medications that cause dizziness. A snack that disrupts your sleep or causes you to rush to the bathroom several times may not be helping your health. When you do want an evening snack, consider eating it 1 to 3 hours before bedtime rather than immediately before lying down. This allows more time for digestion and gives you an opportunity to see how the food affects your blood sugar, reflux, bladder, and sleep. I also want to warn you about products marketed as kidney detoxes. Your kidneys are already part of your body's natural waste removal system. They do not need to be flushed with a special juice, tea, powder, smoothie, or herbal mixture. In fact, consuming excessive amounts of water or certain herbal products can sometimes be dangerous, especially for someone with reduced kidney function, heart failure, swelling, low urine production, or a fluid restriction. The correct amount of fluid is not identical for everyone. A healthy person who exercises in warm weather may require more fluid. Someone with advanced kidney disease or heart failure may need to limit it. Follow the instructions provided for your medical condition rather than copying a general recommendation from the internet. If you have normal kidney function and no dietary restrictions, a simple evening option might be half a cup of blueberries or sliced strawberries. You may add a small amount of plain yogurt if dairy is suitable for you. A touch of cinnamon can add flavor without additional sugar. There is no need to turn it into a large smoothie. Blended food is often consumed much faster than whole food. It can also make it easier to combine several servings of fruit without realizing how much you are consuming. Eating whole fruit slowly is often more satisfying and naturally encourages portion control. The greatest benefit of an evening fruit snack is not that the fruit performs a special repair process during the night. The benefit comes from what the fruit replaces. If you normally eat potato chips, processed meat, salty crackers, pastries, cookies, sweetened cereal, or ice cream late at night, replacing that habit with a modest serving of whole fruit may reduce your intake of sodium, added sugar, saturated fat, and excess calories. Over time, those changes may support healthier blood pressure, steadier blood sugar, better weight control, and improved cardiovascular health. Those factors matter deeply to the kidneys. Fruit, however, is only one part of a kidney protection plan. Managing blood pressure and diabetes is far more important than searching for the perfect fruit. Take prescribed medication correctly. Avoid smoking. Stay physically active within your abilities. Reduce excessive sodium. Maintain a healthy weight. Attend medical appointments and complete recommended blood and urine tests. A gentle walk after dinner can be helpful for many older adults. Even 10 minutes of comfortable movement may support blood sugar control, circulation, mobility, and cardiovascular health. You do not need to walk quickly or push yourself until you are out of breath. Choose a safe environment and move at a pace that feels comfortable. If balance is a concern, walk indoors, remain near a stable surface, or perform gentle seated movements. Regular movement is more valuable than occasional intense exercise. You should also know which warning signs require medical attention. Blood in the urine should never be ignored. Persistent swelling around the eyes, ankles, feet, or lower legs deserves evaluation. Ongoing foamy urine, a major reduction in urination, unexplained shortness of breath, severe weakness, nausea, confusion, fever with urinary symptoms, or persistent pain in the back or side should also be discussed with a healthcare professional. These symptoms do not always mean that the kidneys are failing, but they should not be treated with fruit, juice, or home remedies at the same time. Remember that kidney disease may be present before symptoms appear. If you have high blood pressure, diabetes, heart disease, obesity, or a family history of kidney problems, ask your healthcare provider whether your kidneys should be tested. A blood test called estimated glomerular filtration rate, or eGFR, provides information about how well your kidneys are filtering. A urine albumin to creatinine ratio can help identify protein leaking into the urine, which may be an early sign of kidney damage. These tests are much more reliable than trying to judge kidney health by how you feel. So tonight, take a careful look at your usual evening routine. Do you regularly reach for something salty? Do you eat sweets while watching television even when you are not truly hungry? Do you pour a large glass of juice because you believe it is healthier than dessert? Instead of trying to change everything at once, make one practical adjustment. Choose a modest serving of whole fruit that is appropriate for your health. It may be blueberries, strawberries, an apple, a few grapes, a small portion of pineapple, a pear, a peach, or a plum. The exact fruit matters less than the overall pattern. Keep the serving reasonable. Avoid added syrups and sugars. Consider your blood glucose. Pay attention to your potassium level if you have kidney disease. Eat early enough that the snack does not disturb your sleep. If you have been diagnosed with chronic kidney disease, do not build your eating plan from a general list of foods found online. Ask your doctor or renal dietitian a specific question based on my latest kidney function, potassium level, blood sugar, medications, and treatment plan. Which fruits are appropriate for me, and what serving size should I use? That question will give you far more useful guidance than asking which fruit is universally best for the kidneys. There is no single best fruit for every person. There is no bedtime food that repairs the kidneys overnight, And there is no drink that can wash away years of high blood pressure, diabetes, or kidney damage. What can make a difference is a series of realistic choices repeated consistently. A smaller serving, less sodium, fewer added sugars, better blood pressure control, more stable blood glucose, regular physical activity, appropriate medical testing, and an eating plan designed around your actual health needs. Your evening snack will not create a miracle while you sleep, but when it replaces a less healthy habit, it can become one small part of a routine that supports your heart, protects your blood vessels, and reduces unnecessary strain on your kidneys. That is how lasting health is usually built. Not through one dramatic change, but through simple decisions you are willing to repeat every day.